Quality care. In the simplest terms, it's what you intend to deliver to every patient who walks through your doors. But for most healthcare providers and clinics, day-to-day implementation isn't so simple. As 10,000 people become Medicare eligible every day, your clinic's at-risk patient population quickly grows. These patients need extra attention to manage their chronic conditions and to prevent escalating concerns between scheduled office visits. Most healthcare teams are doing their best to meet the increasing demand for regular, ongoing patient outreach, but they wish they could do more. In 2014, the Centers for Medicare and Medicaid Services began paying for chronic care management for patients with 2 or more chronic conditions. The goal of the program is to help patients achieve a better quality of life through continuous care and management of their conditions. CMS has continued to increase reimbursements every year, which creates a significant revenue opportunity for clinics. However, many healthcare centers aren't realizing the full benefits of the program. Many don't have the budget or staff to get effective internal systems off the ground, and some are too overwhelmed with questions and concerns to get started. If your clinic is not reaching at least 35% of your eligible Medicare population, your CCM program is far from optimized. With the help of H3C, you can have a revenue-generating CCM program fully operational in 6 to 8 weeks. No startup fees, no implementation costs, and no long-term contracts. H3C is a chronic care management company that operates with one firm belief. Frequent communication is critical to building trust and improving patient outcomes. Our clinical call center is staffed with healthcare professionals of all levels, specializing in chronic care management. Our goal is to align with your internal workflows and operate as an extension of your team, allowing your staff to prioritize critical tasks and face-to-face patient contact. We handle everything from setup and enrollment to assessments and billing, all while working directly and securely in your EMR system. We start by working with you to identify your qualifying Medicare patients. Then we make outreach by mail and phone call to explain the benefits of the program. Using our process, we expect to enroll at least 45% of your eligible Medicare population, and we typically achieve retention rates of 88% month to month. Patients who choose to enroll receive a monthly check-in call from their dedicated H3C representative. Because we integrate with your team's processes, everything feels familiar to the patient. From the local caller ID to the counsel they receive regarding their health regimen, calls are not formulaic or impersonal. Our advanced software system generates dynamic questions tailored to each individual's circumstances, helping them stay on track with their care plan and minimizing barriers to care. Shortly after we speak with your patients, we send our documentation directly to your EMR. You will always have the most current information without having to learn any additional systems or workflows. You'll also receive ongoing reporting, including monthly risk stratification reports. This allows you to see an actionable snapshot of your Medicare population. If we notice any patient changes or urgent concerns, we notify your clinic's point person right away. With H3C, you maximize your patient outreach through your access to additional remote staff. You enable your providers to have more comprehensive conversations with their patients during office visits, and your patients experience unified care from an attentive healthcare team, ultimately enhancing your overall quality metrics. But what's the investment? H3C provides our CCM program and technology at no cost to your clinic. We also help you generate additional revenue. The cost of our services is covered in the reimbursement from Medicare, which is billed under just 2 codes. Our existing partners with 1,000 or more enrolled patients generate an average gross revenue of $920,000 per year. Clinics that work with us quickly discover that we're one of their top sources of revenue. You can see why physicians, nurses, and clinic administration are thrilled with the results of a partnership with H3C.
So what is it that they do that separates them above and beyond is they listen to my needs and then they personalize their approach for me. This is the question that physicians will ask when a CCM vendor comes, well, how much extra work are you going to cost me? H3C is one of the few vendors that I've vetted, and I've vetted between 10 and 12, that pays very close attention to decreasing your administrative burden.
We know how important it is to protect your patient relationships, as well as your clinic's distinction for quality care. That's why we're here, to supplement the care your staff provides, not compete with it. Let us do the time-intensive work of increasing connection with patients between visits, so you can provide more responsive, personalized care in person. Pause for a moment and imagine what could be accomplished at your organization with the additional time and revenue you get back. In this case, time truly is money. Contact H3C today to see how your clinic can quickly and easily implement our CCM program.